Okay, so we went ahead and removed Mrs. Doe's old dressing. We cleaned it out, and now we're ready to take some measurements and put a new dressing on. Okay, so first I'm going to start by examining Mrs. Doe's wound, starting with the peri wound. There appears to be some trophic changes, a little bit of xerosis, maybe some callus in some spots. I don't see any fungus on her toes. Let's see, maybe a little bit of a bunion. Her skin appears to be intact. There's no surrounding wounds. Maybe a little bit of erythema. It's kind of hard to tell, but it might just be the color of her foot in the shadow, but there might be some around the plantar surface of her foot. Looking at the wound edges, it does appear calloused all the way around, a pretty good amount. There does appear to be some trophic changes there as well, some dry skin, so xerosis. The edges are epithelied inside the wound. So, okay, so looking at the wound base, it is a full thickness wound. It appears to be 100% viable. It looks beefy granulated color, beefy red granulating tissue color. So looking at the wound walls, it's hard to tell if there's any tunneling or undermining from here, but there very well could be with the callus, the epithelial edges, with the shear force from her walking. There could be some, but we'll have to take some measurements here in a little bit to determine that. I don't see any drainage coming from her wound, but her husband did mention that there was some draining in her sock, but I don't see any here to document that at the moment. Okay, so Mrs. Doe, we're gonna go ahead and take some measurements from your wound so we can track its progress. Is that okay with you? Okay, so I've already sanitized and donned again, so I'm good to go here. I'm gonna go ahead and take a measuring tape. So I'm going to use this to measure Mrs. Doe's wound. I want to measure in centimeters. So I'm first going to orient myself with her foot. So in anatomical position, her toes would be at 6 o'clock. Her heel is going to be at 12, and then 3 and 6 is what we'll use for our clock. So for the length, we're going to want to take the longest portion of the wound. So we're going to find that, measure it in centimeters. So that looks to be about 5 centimeters here. And since it's not in line with her foot position, it's a little bit oblique, we're gonna go ahead and document that using the clock method. So at this angle, it looks to be about 4 and 10 o'clock is what I'll document. And then for the width of this wound, I want to make sure it's perpendicular to the length. So going off of the length, here's our width, and that looks to be about 3.5. So again, we want to make sure we document it using the clock method. So for here, it would probably be around 1 and 7 o'clock, and then 10 and 4 is what I will document. So I'm going to go ahead and throw this tape measure away. Now I've left my clean field, I'm going to go ahead and dock, sanitize, and don. Now we're going to take measurements for the depth, undermining, and tunneling, if there is any. So I'm going to grab a cotton tip applicator and a measuring tape. So I'm going to make sure I hold the tip applicator with my thumb so that way I can use it to accurately take a measurement. So when determining the depth, I'm going to find the deepest portion of the wound base. I'm going to stick my cotton tip in it, and I'm going to feel for the infeel, but I want to make sure I find the deepest portion, and that's where I'll take my measurements. So if I go down to the bottom, feel the infeel, and I will mark it with my thumb when it's flush with the wound edge, and then I will take it to the measuring tape, and that looks to be about 3 centimeters, and that's what I'll document. When doing the tunneling, I'm going to palpate around, or just probe around the wound walls until maybe I find a tunnel. And if I do, I'm going to assess the infeel, just keep going until I find it. document that infill, mark it with my thumb like I did with the depth, and then I'm going to measure it, so about 3 centimeters again. And with the tunneling, I want to make sure I document where it's located, so using the clock method again. So if I was here, I would document the tunneling at 4 o'clock. Okay, so looking for undermining, again, I'm just going to probe around the wound edges or the wall. And if I find undermining, I want to make sure I document the start and the end. So for example, for here to here, I would measure, it starts at 7 o'clock and ends at 4 o'clock. Okay, and then I'm also going to want to document the deepest portion of the undermining. So I'm just going to find the infill again, like I did with the tunneling, flush with the wound edge, mark it with my thumb, and then come back and measure it with my measuring tape. And that one looked about 3.5. So that's what we're going to go with the undermining. Okay, so we're done with our measurements. I'm going to go ahead and dispose of this. I'm going to doff, sanitize, and don one last time, so that way we can go ahead and put on a new dressing, okay? So now that we have applied a new dressing, we're just gonna go ahead and talk about the wound a little bit more. So we know our patient is a 60-year-old female. She said she started a new job as a grocery clerk and she bought a new pair of shoes. So she's walking all day. The new pair of shoes may need to be broken in. And it was actually her husband who noticed some drainage on the bottom of her foot, which tells me that she didn't feel, or wasn't able to feel this wound on the bottom of her foot up until the husband mentioned it. And even then she might not even feel it. Just looking at the wound, it's on the plantar surface of the foot. It's got that round punched out look. It's calloused around the edges. All of these things are suggestive of a neuropathic ulcer. And then looking at her ABI, she scored a 1.4, which could suggest a vessel calcification, which is common in those with diabetes who will need to do further tests to determine this. However, we also tested her venous filling time, which was 20 seconds. A normal should be around 5 to 15 seconds. So this was concerning. This is suggestive of arterial insufficiency often. So we will, and that is also common with those with diabetes. For her monofilament test, we tested the plantar surface of her foot and she wasn't able to feel 5 of the 9 locations, which is suggestive that she has lost sensation, protective sensation on the plantar surface of her foot. However, the dorsal remains intact. She's able to have protective sensation on the dorsum of her foot, but we are more concerned about the plantar surface at this point, since 4 out of 10 is concerning to us as far as not being able to feel those points. So, and her right lower extremity, the girth is symmetrical to the opposite leg, which tells me that maybe there's no edema, there's nothing like that I need to be concerned about. So they're symmetrical, they're good. So all of these findings all tie back into a neuropathic ulcer. So we will need to do further tests to determine if maybe she does have diabetes and come up with a good intervention plan for her from here.